Does this erectile dysfunction medication affect your PSA test results? Let's look at what the evidence actually says. If you're taking tadalafil for erectile dysfunction or benign prostatic hyperplasia, and you also need to keep an eye on your prostate health, you might be wondering whether your medication could interfere with your PSA test. It's a really common question, and the answer matters. So let's get into it. Tadalafil belongs to a class of medicines called PDE5 inhibitors. It works by blocking an enzyme that allows smooth muscle to relax and blood flow to improve. For erectile dysfunction, that means better blood flow where it's needed. For benign prostatic hyperplasia, it helps relax the smooth muscle in the prostate and bladder, which can ease urinary symptoms. Now, here's the key point. Unlike some other medications used in prostate conditions, particularly a class called 5-alpha reductase inhibitors, tadalafil doesn't affect androgen metabolism or prostate tissue growth, and that distinction really matters because it means tadalafil doesn't interfere with PSA production. Multiple clinical trials and regulatory documents consistently show that tadalafil has no significant effect on PSA levels, even over extended periods of treatment. So if you're taking tadalafil and you have a PSA test, your doctor doesn't need to adjust how they interpret the results. The test remains a valid monitoring tool. That's reassuring. But it also means something important on the flip side. If your PSA levels are rising while you're on tadalafil, that rise is unlikely to be caused by the medication, and it should be investigated in the usual way, just as it would be for anyone else. It's also worth knowing that in the UK, there's no national PSA screening program. If you're unsure about PSA testing and what's right for your situation, your GP is the best person to speak to. They can talk you through your personal baseline, how often monitoring makes sense for you, and what changes would warrant further investigation. If you're starting tadalafil for BPH specifically, a baseline prostate assessment, including a PSA test, is typically recommended before you begin treatment, so your doctor has a clear picture from the outset. On the safety side, tadalafil is generally well tolerated. Common side effects include headache, indigestion, back pain, muscle aches, flushing, and a blocked nose. These are usually mild and tend to settle on their own. There are some important interactions to be aware of though. Tadalafil must not be taken alongside nitrates. That includes certain heart medications and recreational drugs, sometimes called poppers, because the combination can cause a dangerous drop in blood pressure. The same applies to a medicine called riociguat. If you take alpha blockers, your doctor will want to monitor you carefully. Always take tadalafil exactly as directed by your prescriber. If you experience chest pain, sudden vision changes, or a prolonged erection lasting more than a few hours, contact a healthcare professional promptly. You can also report any suspected side effects through the MHRA yellow card scheme. So to recap, tadalafil does not significantly raise or affect PSA levels. Clinical evidence is consistent on this. PSA testing remains a reliable monitoring tool for men taking tadalafil, with no need to adjust how results are interpreted. And if your PSA does rise while you're on tadalafil, speak to your doctor. It should be investigated as it would be for anyone. Just to be clear, this video is for general information only and isn't a substitute for medical advice. Please speak to your GP or pharmacist about your own situation. If you found this helpful, leave a comment below. We'd love to hear your questions. And if you want more straightforward, medically grounded health information, give this video a like and subscribe to the Bolt Pharmacy channel. We'll see you in the next one.